A thyroglossal duct cyst, sometimes just called the thyroglossal cyst, is a congenital disorder where the thyroglossal duct, which is a tiny canal connecting the thyroid gland with the tongue during fetal development, grows in size and fills up with mucus, which forms a cyst. Now, normally during fetal development, a tiny depression called the foramen cecum forms at a spot between the front 2/3 and the back 1/3 of the tongue. The tissue underlying the foramen cecum is different than the rest of the tongue, and its cells develop into the thyroid gland. Through development, the thyroid gland tissue migrates downward as it grows, but it still stays connected by a tiny canal called the thyroglossal duct. The thyroid gland descends down past the base of the tongue and the hyoid bone, which is a small bone present below the chin, before it finally settles down in front of the trachea, in the neck. The walls of the thyroglossal duct are lined by lymphoid cells, as well as epithelial cells which secrete mucus into the cavity. Normally, once the thyroid gland has reached its final resting position, it stretches out a bit and the walls of the thyroglossal duct stick to each other, which obliterates the canal. Over time, the thyroglossal duct starts to disintegrate, and by the 3rd month of fetal development, the duct is usually gone. In some people, though, the thyroglossal duct doesn't close completely, and instead parts of it widen to form pockets, or cysts. The cysts get filled with the mucus secreted by the epithelial cells in its walls. These mucus-filled thyroglossal duct cysts stick around as the fetus develops, and then they can cause a few problems. For example, when there's an infection of the respiratory tract, it can easily spread to the thyroglossal duct cyst, since there are lymphoid, aka immune cells, in the walls of the cyst. Local inflammation also stimulates the epithelial cells of the thyroglossal duct cyst to increase their secretions, and that makes the cyst grow in size. Second, the thyroglossal duct cyst can enlarge to a point where it bursts open, letting the mucus pour out, and that can form a discharging sinus, which is sometimes also referred to as a thyroglossal fistula, even though it's usually not a true fistula. Now, these can also form if the thyroglossal duct cyst is damaged during surgery. Third, in some people, the thyroid gland cells remain within the thyroglossal duct and don't descend down. If that happens, a thyroid gland might not develop normally, and in addition, very rarely a thyroid tumor might develop in the cyst, since there are still thyroid cells in the walls of the cyst. The most common symptom of a thyroglossal duct cyst is painless swelling in front of the neck, which can lie anywhere along the path of the thyroglossal duct. Usually it's midline or just slightly off of the midline, and the most common locations are subhyoid, or just below the hyoid bone, and suprahyoid, just above the hyoid bone. Because of its connection to the tongue, the thyroglossal duct cyst moves up when a person swallows or sticks out their tongue. Also, the cyst might appear red and be painful if the cyst gets infected. The diagnosis of a thyroglossal duct cyst is usually done with an imaging study like an ultrasound or CT scan, and confirmed with fine needle aspiration. Sometimes a thyroid function test is done to assess whether the person has a healthy thyroid gland. Treatment of a thyroglossal duct cyst is surgical removal of the entire thyroglossal tract. In addition, antibiotics might be used to treat infections. Alright, as a quick recap. As the thyroid gland descends during development, a tiny thyroglossal duct forms. If the thyroglossal duct doesn't close in on itself, it can start to fill up with mucus, which creates cysts anywhere along its tract. These cysts are usually midline on the neck, just above or below the hyoid bone, and can be surgically removed.